Good morning, everybody. My name is Bobby Beeler, and on behalf of Redwood Credit Union, I'm pleased to welcome you all to this morning's public forum on the Affordable Care Act. Thank you very much to Congressman Thompson and Supervisor Zane and both of our speakers for their participation this morning. For those of you who aren't familiar with Redwood Credit Union, I'd like to take a brief moment to tell you a little bit about who we are. Redwood Credit Union is a full-service financial cooperative offering affordable banking services to consumers and small businesses. Our mission statement says it best: we passionately serve the best interests of our members, our employees, and our communities. As part of that commitment to serving our communities, we're honored to partner with other local nonprofits and organizations by making our Sonoma Community Room available free of charge for events such as this morning's public forum. I encourage you to walk through our gallery just outside of this room, where we've taken the opportunity to share a little more in-depth the history and story of Redwood Credit Union. We've been here since, or been around, not in this building, but been a credit union since 1950, and we currently have 18 branch locations throughout the North Bay and San Francisco. We serve 220,000 members, and anyone living, working, or owning a small business in 8 North Bay counties are all eligible to join. There's additional information on your seats or in our Welcome Center. And again, thank you and welcome. At this time, I'd like to turn it over to Congressman Thompson.
Thank you very much. Bobby, thank you for the introduction, and thank you for making this great venue available to us. I thank you, and I thank Redwood Credit as well. Also, I want to thank the folks who are here today that came out to learn about the Affordable Care Act. I appreciate you being here, and a very special thank you to the folks on the panel, Supervisor Shirlee Zane from the Sonoma Board of Supervisors, Herb Schultz from Health and Human Services, Region 9 Director. I always like being with Herb because he's the one person who has a district and district responsibilities that encompass more geography than my district. So it makes me feel rested. Thank you. And Mark Quinn, who's the Regional Director for the Small Business Administration. And not only does Mark do that job and do it well, but he's also part of our 5th Congressional District. So he knows not only the issues, but he knows the people in the area. What we're going to do today, everybody's going to make a brief remarks, and then Herb and Mark will impart the wisdom on us all, and then we're going to take questions. And the questions, I think you've been asked to write those down. County staff will sort it out by category, remove any duplicate questions, and then we'll get to the heart of the issue. And we're going to do it because it's important. The implementation period for the Affordable Care Act is now. And it's really important that we get this right. And I can't emphasize that enough. And the reason that it's important that we get it right is the same reason that we have an Affordable Care Act. That's because we were in crisis, a national crisis in this country because of health care. And this is a response to that national crisis. And in order to get it right, not only do we have to know the information, we have to know the correct information. And I say that for a couple of reasons. One, there's all kinds of rumors and innuendo about the Affordable Care Act, and it's important to cut through that. It's very interesting right now. There's some poll numbers out that show that the public opinion of the Affordable Care Act or Obamacare is down kind of low. I think it was at 39%. But interestingly, if you drill down in that same poll, the individual components of the act are over the top. People like all the pieces of it, but they don't necessarily like what they think or what they've been led to believe is this terrible Obamacare. Now, interestingly, last night, flying home from D.C., one of my seatmates was Drew Altman, who's the president of the Kaiser Family Foundation, and I was talking to him about that, and he said, drill down even further in those polls. Those are our polls. He says, the other thing that's really interesting, almost 40% of the people polled believe that death panels are still part of Obamacare. And I thought that was interesting because that was part of that effort to discredit this effort to deal with the health care crisis. And a lot of that discreditation is still out there. So it's important to get this and get it right. Just a couple of facts that I think we should know before I introduce the panelists. One, this bill is paid for. Not only is it paid for, but in the first 10 years, it reduces the federal deficit by about $110 billion. It goes up to $1 trillion in the second 10 years, so $1 trillion over 20 years. It's already paid rebates. I think that's part of your. We've done this. This isn't our first rodeo. That is part of your presentation, so I won't get into the numbers. But it's already provided rebates to millions of people across the country. Healthcare spending is slowing. Medicaid has seen a $700 billion improvement as a result. And I'll say it, I know Herb got criticized for it at a forum we did the other day, but it also provides free preventive health care provisions. And somebody said, well, nothing's free, and I guess that's probably true. But if you're going in to get preventive health care, it is free to you. And that's important to point out. Kids don't have to be worried about, and their parents don't have to be worried about pre-existing conditions. That can't be used to prevent kids from getting health care. And there's no longer lifetime caps on the usage of your health care that you've worked for and paid for. And next year it even gets better. The pre-existing condition expands to include adults. About 32 million more Americans will have access to health care, and women can no longer be discriminated against. So the pricing has to be fair. And these are all important things. It's important to know it. And as nonprofits and small business folks, it's important for you to have the right information. Now, I'm going to introduce Shirlee. She's going to make some remarks, but I just want to remind everybody, we're here to get accurate information about the Affordable Care Act. We're not here to debate it, and we're not here to litigate it. This thing has been done ad nauseum. We have in Congress, this last week, we voted for the 38th time in the House to repeal Obamacare. It's not going to happen. It's a waste of time. It's a waste of taxpayers' money. It's been litigated through many state courts, through many federal courts, and it's been litigated at the United States Supreme Court. It's the law. We also we staked a presidential election on it, and it was very, very clear. One person wanted to repeal it, one person wanted to make sure it worked. So we're here to find out the facts today. Shirlee Zane from the Board of Supervisors.
Thank you. Thank you, Mike. I understand they gave me a step stool up there, but if you can all see me, I'll stand here instead because the podium's so high. First of all, I want to thank everybody for being here, and especially the congressmen for sponsoring this town hall meeting with me and bringing our esteemed guests. And they've got a lot of information, so I'm going to make some brief opening remarks and tell you just a little bit about what the county's doing to implement affordable health care. You know, Congressman Thompson did refer to this crisis that we're having in terms of 60 million people having no health care. By the way, 45,000 people die every year because they do not have health care coverage. So to not think that this impacts people's lives is just silly. It absolutely does. And we do pay for health care. It's just that right now we're paying for it in the jails, we're paying for it in the emergency rooms. We're paying for it at a great, great cost without any prevention care at that. But as he mentioned, you know, prevention is going to be a big part of this, and we have actually for the last year and a half been paying for some of these prevention and screening tools, especially for our Medicare patients. So if you look back to actually 1965, when Medicare was implemented, Medicare continues to be the most popular, speaking of a government-run healthcare organization, the most popular healthcare or insurance basically in all of America, with about a 3% overhead. 50% of seniors had absolutely no health care back in 1965, and that's when the Johnson administration implemented Medicare. So we've come to another crisis, and that's why we've come to this point of affordable health care. So we've got about 100 days until October 1st, where we're going to see the first step in that reality, which is enrollment into health insurance through the Covered California. And then soon after that, we're going to see an expansion of Medicaid to people who for far too long have had no health access. That expansion has been adopted by various states, and California is one of them, and it will enroll many people here in Sonoma County who currently have no health care. So we have an estimated about 70,000, get that number, 70,000 residents in Sonoma County without health insurance. And if we can get everyone eligible to enroll as the exchange opens starting October 1st, and through the Medicaid expansion, we're going to possibly get 50,000 people to obtain health insurance. 50,000 out of 70,000. So the impact is really huge. By the way, we always talk about business and healthcare. The number one reason why people file for bankruptcy in America is because of health costs. So just a little fact there. Medicaid expansion is going to benefit people who already have private coverage. This is an interesting fact. So that with Medicaid expansion, if you have private coverage right now, you may qualify for services that are going to absolutely be at lower costs. And that's going to probably impact about 124,000 Sonoma County residents that are currently eligible for Medi-Cal. Also, 21,000 individuals in Sonoma County will be eligible for tax credits to subsidize the cost of private insurance through Covered California. And then, of those uninsured citizens in Sonoma County, more than 12,000 are employed by private or nonprofit business. If you're one of those people, would you just raise your hand? I'm just curious as to who our audience is this morning. If you're employed by a private or nonprofit business, would you raise your hand? That's what I thought. Good, I'm glad you're here this morning. I think we'll have lots of good information for you. But you will be able to have insurance through Covered California. And then I just want to wrap up with just a couple of things with what we're doing here in Sonoma County. The other thing that's exciting about affordable health care is that we're going to be able to finally get closer to mental health parity through expanded coverage. We know that mental health is an important part of good physical health, and we will be able to get closer to mental health parity through integrated care. So Sonoma County is doing several things. We're doing outreach, education, and enrollment through our Department of Health Services and Human Services. We've launched a website. We'll give you, I think you've got information on your seat about that. We've also received a grant through the Department of Human Services and the Redwood Coalition of Health Centers to provide education and enrollment. And we're going to be doing that through mobile devices, through schools, and through a system of community coalitions. And also through the Department of Health Services, the Board of Supervisors recently approved a whole series, literally millions of dollars of capital investments in our community health centers to expand capacity, because we'll have a lot of people who will now be eligible for health care. And then finally, these investments are in addition to funding provided by the Department of Health Services to support navigators. We will have navigators that will be available and online through the Sonoma County phone number and the website, and they will be out in our community health centers as well as schools and churches and nonprofits. So if you run a nonprofit or a church and you'd like a navigator, please talk to us, because we're going to be sending them out to the community and they're going to help with the enrollment process. So we're really doing something. We're very proactive. Matter of fact, the counties throughout the state are looking at Sonoma County because we are leading in so many ways. And thank you to our incredible Department of Health and Human Services, Rita Scardacci, Mike Kennedy, Jerry Dunn. You guys are super. And again, thank you for being here, and I look forward to a fascinating and lively debate, or not debate, but questions. No debate. Skip the debate. Skip the debate. Sorry, wrong word, Mike. And lots and lots of information. The debate is done. It's the law. Thank you.
Shirley, thank you so much. Thanks to all the county staff that are doing such a good job. All right, Herb is, as I said, the regional director for Region 9. He has responsibility for more states than I have responsibility for counties. And he does a great job. He knows this stuff inside and out, and he's available to everyone and anyone. So Herb, thank you very much for joining us.
Good morning, everyone. Good morning. Everyone have enough coffee? Let me ask you a couple of questions as we begin this morning. How many of you are consumer representatives? You work for a consumer organization, you're consumers, you buy health care. Just how many of you are consumers in the community? How many of you represent small businesses under 50 full-time equivalent folks? What about the nonprofit community? Okay. How many of you are medium to large businesses, anything over 50? Great. How about providers, hospitals, physicians, nurses, social workers, any type of providers? Any of you work for healthcare organizations or health plans? How about labor representatives, folks from labor that are here? Academics, the universities, philanthropies, everyone else. Okay. Well, it's great to have such a diverse crowd because I think we've got a lot of great information, as the Congressman and as the Supervisor said. It's a pleasure to be here with my colleague Mark Quinn, who will speak a little bit later on the SBA and the partnership that we've built on this issue. But I want to start with this, and that is that Congressman Thompson, we have been now, this is probably our 4th event together. And I can tell you that one thing I always tell folks is, you know, the Affordable Care Act, or Obamacare, did not happen because of Washington. It happened because people across this country over a 20-year period came to a conclusion that our healthcare system did not work and that something needed to be done about it. And with the leadership of President Obama, Secretary Kathleen Sebelius, I'm honored to be a presidential appointee and work directly with the Secretary. But it also took the leadership of Congresspeople like Mike Thompson, who sits on the Ways and Means Committee and is not only somebody who got a chance to vote on Obamacare, but actually led some of the major provisions and the enactment of major provisions that are in there. So I want to give him a round of applause. It's great to see the Supervisor, and thank you, because when we talk in a moment, you know, this is a federal framework, but where does implementation really happen? It happens at the local level, it happens in the tribal level, it happens anywhere that is, you know, federal set the framework. But in my region, state, local, tribal, and actually in the Pacific, so at the territorial level as well. And so it's really important because you all are the decision makers about healthcare, health coverage, and the needs of your families, the needs of employees that you have. And so thank you for your leadership on the Board of Supervisors very much for all things health and human services. So I want to give a round of applause. And I don't know where, I think Rita's here and the county staff, but you know, I feel like in some ways I've been adopted by Sonoma County. I think this is probably close to, I want to say, a couple of dozen meetings over the last 3 years in Sonoma County, and the work of Rita as director and the whole county staff does you all, I think, very proud in terms of really being on the forefront of health, public health prevention, and so thank you to all the county staff for being here as well. Now we're going to start, and I'm going to come back over here, because if I don't have this, we can't start. So let me start off by saying that by the end of this, you'll all have my cell phone, you'll have my email. If you're scribbling notes, that's great. If you're taking out devices and taking notes, that's great as well. But I can make a version of our PowerPoint to you. We can give it to the organizers. You can hand me a card and do that. But you will have enough information now to have, from the federal government side, a 24/7 resource on all things, not only Affordable Care Act or Obamacare related, but about the wide swath of responsibilities that the department has. And so the reason I started with the question I did is really just to basically, the reason that I started with that is because we're all stakeholders in this process. And whether you are a consumer, whether you're a provider, whether you're a business, whether you're a health plan working with folks, whether you're an academic, whether you're a member of a labor organization, we all care very, very deeply about making sure that our health care and our health care coverage works. But it's not just the health care, it's all about the social determinants of health. And so that's an approach that Sonoma County has really been the lead on. So before I get into it, I'm going to spend much of the time, hopefully about 20 minutes or so, really talking about Obamacare, 101 or 201 or 301, depending on where you are in the process. But we are actually at the point where people are starting to tune in, asking the right questions, expressing their issues and concerns, and we've gotten a lot of very, very positive feedback. So my first two slides, what I want to make sure that you know is, look, this law passed March 23rd of 2010. And so on January 1, 2014, when most U.S. citizens and documented individuals are required to get health care coverage, and that's the basic individual requirement. The flip side of that is that nobody can be denied health insurance because they have or have had a pre-existing condition like asthma, diabetes, cancer, heart disease, HIV. I think many of you know I've been a person living with HIV for 22 years. And so when I go into communities and talk about the needs of people who are chronically ill, the needs of people who maybe have not had coverage, or to the supervisor's point, have gone bankrupt because they tried to afford coverage and they were given it. I'm saying it from the heart, and I'm representing the thousands of people that I've met across this region who have lost loved ones or who have suffered, who have not been able to have coverage. And so it is that real concern. So we are on the precipice of finally being able to say in this country that we're going to have health insurance coverage, and you're not only not going to be turned down for that coverage, you can't be charged anymore for that coverage because you are or are not somebody who is suffering or has suffered. I've met too many parents whose children have grown out of childhood asthma, who have had to go to hospital emergency rooms because they cannot get coverage for that child. Obamacare has already changed that because no child under 19, starting 2.5 years ago, almost 3, can be denied. Now we work on sort of the adults. And so I put up this, and I think the Congressman did a great job, and I won't go all the way back through it, because we're not just flipping that switch on. We've spent, with many of you in Sonoma County, you have a very active coalition. We have spent several years now, 3 years, beginning to implement the provisions that for the 80 to 85% of our country that already has health insurance, okay, much of this will not apply because they already have coverage. And so we're really talking about 10 to 15% of the American public, people that have coverage or don't have coverage, and usually we're talking about people who buy coverage on their own, for themselves, for them and their families, for small businesses, but not those that are traditionally insured in other ways, and we can sort of talk about that. So over the last 3 years, when you look at everything that's on the screen, the point that I want to make with this is, and the Congressman really said it, is that this is, healthcare spending is at a 50-year low in this country. Doesn't mean you're going to feel everything right away, but beyond the economy and the pickup in the economy, there are huge things that we together have done in healthcare reform. This is the cost containment and increasing the quality side by focusing on the delivery of better healthcare integrated and coordinated care, Sonoma County, community health centers, the department has a community transformation grant. Well, what does that mean? It means matching health with transportation, with environment, with education. And you've all been leaders here, and you can look at that. There is a reason when you look at the bottom point, it says $4.2 billion in 2012 in anti-fraud, $15 billion. There is a reason that our Medicare Part D, the prescription drug program, the premiums for that have been flat for the last 3 years. There's a reason that the deductible for doctor's visits in our Medicare program has decreased. And a significant part of that is because of these provisions that were put in, not only increasing quality and containing costs, that doesn't mean cutting benefits. That means making sure, as the supervisor said, that there's preventive health benefits that are provided free of charge, out of, range, not out of your pocket, but free of charge so that nobody has a barrier to access those particular services. So the two legs of the stool we're not going to talk about as much. We're going to talk about the coverage expansion, and that's the first leg. But when you look at 2 and 3, one I just said was cost containment and quality improvement, but the other one is consumer protection. So for those that have insurance, and this is the California version of it, and you look at statistics like that, top stat is now over 500,000 young adults between 19 and 25 getting health insurance coverage on their parents' plan. Okay? It's over 3 million nationally of new people that didn't have insurance, young adults 19 to 25. 300,000 people on Medicare, people with disabilities as well as those over 65 who have actually been able to get prescription drug discounts, deep ones, so that at a certain point they used to have to pay 100% of their prescription drug costs when they were most vulnerable. And that is being eliminated. 2.1 million people receiving free preventive services in Medicare, and we're talking about, in the commercial population, 8 million. So that talks about cancer screenings, mammographies, colorectal screenings, diabetes screenings, domestic violence screening and counseling, and others. 12 million residents have had lifetime limits removed. And in January, that becomes annual limits removed as well. That doesn't mean your health plan pays for everything. That means you cannot run out of your benefit, rendering you uninsured. That's what that means. So it says you're not going to be running to an emergency room, trying to get assistance, and going to a community clinic where you're not, if you will, being able to show that you have health care coverage. And so it does not mean you're getting everything, but it means you cannot be rendered uninsured because you have a chronic health care condition that does that. So that sort of brings you up to where we're going to talk about coverage expansion today. And I'm going to spend most of it talking about this new marketplace, this new exchange called Covered California. But I do want to mention a moment, because we have mentioned up here, there are really two dominant ways that those that are uninsured will get, or even those that buy coverage on their own that may want to now comparison shop. But one of those ways is Medi-Cal expansion, because in this country, for individuals, largely childless adults, under 100% of the federal poverty level, so we're talking about $11,000, right? Before this law passed, you had to be basically disabled, poor pregnant women and children. Not a lot of men could qualify in those categories, but some of the most low-income people in this country were not qualified, eligible, if you will, for Medicaid, uninsured by virtue of that. So what happens here? So the one part of the expansion that we want you to know about is just that anyone making $16,000 a year or less, regardless of disability, childless adults, will have access to a comprehensive health care plan at low or no cost because they will qualify for this expanded Medi-Cal program. And in California, that's probably up to 1.4 million new people coming into coverage. And that's not even facing that we have 2.5 million people in California that actually qualify today that are not yet on the program. And so the important thing is that you should know, for many of you who have, how many of you are, have elderly parents? Okay. You may be used to the sort of old rules where you had asset tests and people had to spend down before they could qualify for Medicaid. You had a loved one who needed to go into some form of care, but they had to have less assets. There's not an asset test under this particular program, and that's an important fact that's there. And the federal government will pay 100% of this cost over the first 3 years, and 90%, meaning the state will pay nothing and it will pay 10%. And without getting into all the technicalities, that's a difference from today that the state has to put up 50 cents for us to give them 50 cents. This is paid for by the federal government. And for those of you that are providers, primary care providers in Medicaid, we'll see $11 billion in extra reimbursement over the next 2 years in every state in this country to help those who are getting their coverage, childless adults, through Medicaid, to do that. And I do want to mention, next, going into the marketplace. So that's Medicaid expansion. People under $16,000 a year, actually families under $33,000 a year, there's a way for them to qualify as well. But what we're going to spend most of our time now talking about is, how many of you have heard of this thing covered California? Great. How many of you heard the word marketplace? Exchange? Great. That says a lot about the education and what you're doing in the community. But one of the things that I think we're going to sort of talk about most in this is that everybody seems a lot to think about October, seems to talk about January 1st. That's the date when the individual requirement goes in, right? October 1st is the date I want you all to remember, because we're less than 70 days away. Less than 70 days away from open enrollment in California, through Covered California, where individuals buying coverage on their own, individuals and their families, and small businesses under 50 full-time equivalents. And full-time in the law is 30 hours per week, and part-time is half that. So that is what we're going to talk about in terms of Covered California, but it's a marketplace. It's a place where individuals and their families, and those in small businesses can actually go and shop for coverage. And we'll talk about what that means, and I'm going to show you a video in a minute to sort of illustrate it. And it's only a 93-second video, so I have no concern about that. But it is a cartoon, and it's a fun way to take a look at it, while we then go on and talk for about 10 minutes more about what Covered California is. So if you can do the video, that would be great.
You can do all the things you do with more peace of mind, less worry, and more financial security when you know you've got health insurance. And now everyone will be able to find health insurance at the Health Insurance Marketplace. It's an online shopping site where you shop for health insurance that fits you with low cost and even zero premium plans for those whose income qualifies. If you or your family are uninsured or just looking for better coverage, you can see your options all in one place with one application. It's a place to compare a wide range of quality health insurance plans, to review them all side by side, and choose the one that's right for you. You'll find the information clear and easy to understand. You'll explore the marketplace at your own pace. You can compare prices and benefits, see an explanation of what a premium is, and what a plan will cost you every month before you make a choice. and every plan will cover you with comprehensive benefits. From your visits to the doctor or the hospital, to your prescriptions, to screenings for cancer and other conditions. And no plan can turn you away, even if you already have an illness or condition. The Health Insurance Marketplace, part of the healthcare law, opening October 1st. You can learn more right here, right now, and be ready for the new world of health insurance shopping.
I know it's nice music, you won't hear it. So it's an easier way to shop for health insurance. And we'll talk about a lot of the different components of, in this state, as I said, the state-based marketplace is Covered California. And $910 million has been given to Covered California to build this marketplace with significant input from residents, citizens, people across California, be they doctors, be they health plans, be they consumers, be they labor, be they businesses. But it has come up and will be opening up its doors on October 1st. And we will talk about, because they will have to provide opportunities not only online, but there will be opportunities all over the state to be able to enroll in person. You can do it through mail, you can do it through fax, you can do it through the phone in their service center. So it is not just a web-based system, but for the bulk of people that do look at the web, you actually can do that. How many of you may be agents and brokers? But I should have, when talking this a little while ago. Agents and brokers will be able to continue to provide their vital services in the community to do that. So where I talked about Medicaid or Medi-Cal expansion, those under $16,000 a year, those going to participate through private health insurance plans in the marketplace. And there will be 13 plans that Covered California in the individual market. They've not announced the plans yet for the small business market. And so it'll depend on where you live as to how many options you have, but you will all have options with which to choose from. And this is where, if you have low or moderate income, where advanced premium tax credits, okay, subsidies that will be provided to help you pay your premium. And for those that are actually on the lower end of low income, they actually will have discounts on their out-of-pocket costs, the amount that they have to put out for those. And we estimate there's about 25 million people in this country that will be eligible for coverage, those who are uninsured, and about 90% of them will likely qualify for some form. And as I said, we're talking about advanceable tax credits. So it's not done at the back end with your tax system in terms of paying a premium and having to get money back. It's actually, if you're supposed to pay $500 and your tax credit is $300, you're only billed for $200 by your insurer. So there is an advanced thing, and it's an apples to apples comparison, price, quality. You can actually go on Covered California's website, and you can put, if you're one of those folks now who are individuals buying coverage on your own, buying for you and your family, or you're a small business and you already have insurance, you still can go on and look and compare. You may get a better deal. But for all of those folks who are uninsured, a significant number will be able to utilize, whether it's a state-based marketplace or tell your friends and relatives, there are marketplaces that will open in every state. Some are facilitated by the federal government, some are partnerships between governors and the federal government, and that's the bottom line there. So here's the issue. So, well, who qualifies for those tax credits? The Medi-Cal expansion, individuals under $16,000 a year. Individuals making between $16,000 a year and $45,000 a year. $16,000 to $45,000 a year. And that's families of four, roughly between $33,000 and $92,000 a year. $33,000 and $92,000 a year. Will be eligible for these advanced premium tax credits to help pay for health insurance coverage under the Covered California rubric. And so, how many of you said before, are small businesses? How many of you are small businesses under 25 full-time equivalents? All right. If you're already offering insurance today, or you're going to be offering, they're actually, I call them small employer tax credits, but they're small employer credits because you can be a nonprofit, you can be a tax-exempt employer. And you can already qualify today for 25 to 35 cents off a dollar premium if you fit into the category. Next year it actually becomes 35 and 50 cents on every dollar. But if you already provided and you think that you may have qualified, the IRS will let you go back if you qualify and sort of take the credit that you didn't have. But for tax exempts next year, this credit will be 35 cents for the tax exempt and 50 cents. That's 50 cents off a dollar of premium. And that's been in effect since 2011, and we can talk about 2010, I should say the tax year 2010. And we could talk about what all of that means as a part of it. Now, one of the issues that I think are sort of really, really big is we've talked about this, but I want to go into the benefit side because you're all probably thinking, okay, this is great. This is meant to look like large employer coverage. And that reminds me of a fact Mark and I were talking about in the car this morning. So, let me ask you a question. What percentage of the employers in this country do you believe are employers with less than 50 full-time equivalent?
90%.
This is such a smart county. 96%. 96%. So one of the biggest pieces of misinformation that the congressman alluded to is that I've talked with a lot of small employers. My parents were small business owners. They owned a restaurant in the Philadelphia suburbs. You can hear the accent for anyone that's from Philadelphia. I usually ask that. They had 18 full-time equivalents. Okay, they could not afford sort of coverage. For any of you that are under, 50 full-time equivalents and under, 96%, there is no penalty associated with if you decide not to provide insurance. And we think most do, and many do. But there is no penalty associated with that. It's only the issue of the 50 full-time equivalents and greater. But we've already said that's 4%, right? What percentage of the 4% out of 100 do you think those 4% provide insurance today? 96 to 98%. So we're basically talking about 1 to 2% of the employers in this country out of 6 million firms that will make a decision. Do we provide health insurance, or do we pay a fee, a shared responsibility fee, to help expand coverage to the vast majority, hopefully, of those that don't have coverage? Okay? So saying that again, so if you're in covered if you're under 50, well, your 50 full-time equivalents are under, you can go into what's called the shop exchange. It's the small business side of Covered California as opposed to the individual. You can potentially be eligible for those tax credits associated with that. But again, we're talking about small employers, individuals, and individuals that buy coverage on their own. So competition, affordability, quality, and transparency. So here's the other main point that I wanted to put in there so that we have enough time for our discussion today and for Mark to come up here. So I've said to you, here's Covered California. Here's the state-based marketplace. It's a one-stop entry. We put out a draft of an application. That application was too long, according to the American people. And it went in 1 month from 21 pages to 3. Okay? Yeah. And the 21 actually reflected sort of the way taxes are done. But people stood up. And believe me, Congressman and I have been to a lot of events. People were like, what do you mean 21 pages? you change that. 3 pages. I think it's 4.5 if you're a small employer. It can be done electronically, and there are organizations that are being funded through Covered California in the community to do outreach, education, and help motivate people to coverage, because that's the best way to be able to do it, like this, in the community by community-based organizations. And they can be provider associations, small business associations, consumers, county governments, things of that nature. And there will be thousands of assisters in organizations in your community who will be able to help people enroll. And so when you come in the front door of Covered California and you fill out that application, if you're Medi-Cal eligible, they're going to tell you exactly where you need to go with that application to make sure at the county level you're in Medi-Cal. And then in Covered California, they will work in terms of the subsidies to be able to do that. So this is the benefit side that the congressman and the supervisor were talking about, which is major because, well, okay, this is a great marketplace for individuals and their families, and small businesses under 50 full-time equivalents and less, not self-insured firms. Okay, self-insured firms do not have to follow these. But look at the benefits. Mental health and substance use parity. That's parity with medical and surgical benefits. Maternity and newborn care. Prevention and wellness services and chronic disease management. This is not those free preventive health care benefits. This is on top of that. You've heard about seniors being able to go to annual wellness visits free, and millions are taking that up. More than, hundreds of thousands, I believe, in California. But this is for all of those people that are insured. To begin to make prevention, and there are actually discounts for group health plans and for individuals who engage in worksite wellness and things of that nature. Habilitative services and rehabilitative services. And another one that I want to mention is pediatric services, including oral and vision care. Adult dental would have to be different. But this is the required benefits that are under here. And regardless of whether you get your coverage inside Covered California, you go out in the private market and get it, or you go into Medi-Cal, these 10 essential benefits have to be in there. The services can be different in the Medicaid space, but these benefits all have to be there. And so in the managed care side of Medi-Cal, mental health and substance use parity, focus on prevention, pediatric, oral, and vision care. And the governor signed and the legislature passed a budget recently that actually is asking us to help them put in a long-term care services and supports benefit on the Medi-Cal side. But we have to review some of the ways that they want to do it to see if it's, it can be done that way. So these essential benefits, and in Covered California, what you're going to see is you're going to see 4 levels of plans. The benefits are going to be the same. It's really about how much out-of-pocket costs. How much am I sort of paying out of pocket versus what the plan and the employer pays if it's an employer plan. Bronze, silver, gold, platinum, and it's 10, 20, 30, and 40%. So the lowest level is that bronze plan, but again, California led the country and said, we're going to standardize the benefits for at least the first year. So the benefits are the same. It's really about the out-of-pocket costs, and their website, which you can go on already, you can compare your current plan with the plans that are going to be offered starting on October 1st. So, new way to buy health insurance. It gives you one stop. It gives you a gateway to do Medi-Cal, if you're in Medi-Cal expansion, and a lot of other benefits that we can sort of talk about there. So as I sort of put up my contact information there, let me make sure that I give you a very quick review. October 1st, all across this country, marketplaces, whether they're run state-based marketplaces like Covered California, partnership states, my region, Arizona, federally facilitated, but they're all based on a health plan that's offered, a prominent health plan in the state that was chosen by states and stakeholders. I'll give you our website. It's healthcare.gov, all one word, healthcare.gov. And cuidadodesalud.gov is the Spanish language version. I gave you materials on your chair. All of that is in the materials to do that. But with Covered California, they're required to provide materials and information in 13 different languages across the state. And that's what they're going to be doing as a part of that. And we will continue to be a 24/7 resource to you as you're working through these issues. But let me mention one of the, I think, benefits to sort of end on, because we all care deeply about our senior population, correct? And I should say aging population, because last year I became an AARP member, and I love my discounts. And 2 weeks ago, I hit that 51 mark, and I was like, I don't know how 365 days went as quickly as it did, but I'm sort of there. But we've got a growing population between the 50 and 64, and then obviously sort of moving out. And during the healthcare debate, I used to work for the governor, and I was working on something in my office, and I was sitting in front of my TV, and I'm watching the other body, the deliberative body, the Senate. And I'm watching somebody who, let's just say, was not a fan of the Affordable Care Act. And basically, he said on the Senate floor, and they even want to charge you double. You know, when you're 55, 60 plus. Well, today, that average is about 6, 7, 8 times. The older you get, the more likelihood of chronic health conditions, okay? So now when you can't be denied because of a health condition, age, geography, family size, but the great thing about the system is, and this reform, is that if you're a 22-year-old buying a certain bronze plan, whether you buy an individual plan in Covered California or in the private market, and you're 22 and you buy that plan and it's $100 a month, and you're 62 and you buy the same plan, it can't be more than $300. Inside or outside. If you need the benefits of the tax credits, both as a business and that, you have to get your coverage inside. But there is a level to make sure that the lowest to the highest, the youngest to the oldest, pre-medical, does not suffer 6, 7, 8 times more cost, and that it's in that 3-to-1 thing. And that's history. So 415-265-7049 is my cell. Please take it down. You can take out your devices if you want. I know I have colleagues that are like, put that device away. But feel free. But 415-265-7049. And the email is there. And I brought a stack of cards. There's probably enough for everybody in the room. We do a listserv once a week, maybe twice now. All department stuff, but largely it focuses on healthcare reform. You can email me, you can text me for the tech-savvy people, or call me and say, add the list. We won't send you a 300-page regulation and say, what do you think about it? What we will do is put links to a lot of developments, sort of what's happening as we move up, and during an open enrollment that for the first time will be 6 months. It'll be 6 weeks starting next year. But October 1 to March 31st, 2014, that's a 6-month open enrollment period with which you can enroll into that. Some special provisions for our Native American partners and nations that can change every month, and some other things. And I know I work a lot with the Indian country up here as well. But let me stop with that and thank you for the opportunity, and I look forward to hopefully a robust Q&A session.
First, thank you for Redwood Credit Union for hosting this. Redwood Credit Union is an SBA lender, but also is one of the preferred SBA lenders, and actually is, as a credit union, the largest SBA credit union in California doing SBA loans. So it's a really great partner for us and for you and the community. So thank you, Redwood Credit Union, for hosting this. Second, Congressman Thompson, I think that you, as constituents, may or may not be aware of this, but it is the case that Herb and I are throughout California talking with the congressional delegation to the community. No one in California has done as much to outreach to the community and speak to as many small businesses and to as many communities as Congressman Thompson has. So you don't realize this, but no one else in California has had a congressional representative who has been out in the community speaking to as many small businesses as you have had. So you don't realize that you're privileged, but you are. So I thank you for that, Congressman Thompson. Third, I want to thank Herb Schultz, because I think that there's a line that goes around that if there are 3 people in California anywhere talking about healthcare coverage, one of them is Herb. And the depth and the breadth of his knowledge around healthcare issues is just staggering. And I think that, again, you wouldn't know that you're listening to really the expert of all of these issues in federal government that you're hearing from in Herb, but you are. You're hearing from the person who is really the expert on healthcare issues and across government. So you're really privileged again on that. And then last, to thank you all. I've been watching the questions coming in, and this is an audience of A students here. You know, when it comes to the issues and questions, when Herb asked a question about how many of you are aware of the Affordable Care Act, the Covered California, the exchanges, so many of you are really well versed in all of this. That is not the case that we see in most of the audiences we have the opportunity to speak to. So this is an audience of very well versed, very well prepared folks. And when I see all the questions here that are coming in, that are complex questions that they're sorting through, I realize that no one told us that these were all going to be on the final. So I guess we're going to have to study up real quick. But I wanted to do a couple of things in speaking about this. Small Business Administration and HHS are both partnering to get the word out to the community, and particularly to the community of small business. I know Herb asked the question a couple of times, but since small businesses are who I work for, could I get again a show of hands of those of you who work in small business, as small business folks? You're the folks that I come to work for every day, and I'm privileged to work for you. But let me ask another question. How many of you are independent contractors, self-employed, those folks? It's another audience that sometimes doesn't get really recognized as a small business group. I think one of the things that you heard with Herb giving you so much information, dollars, facts, millions of people uninsured, the numbers just wash over us. It's just, there's so much data, so much information, just washes over us. But for me, I deal with small business people every day, all the time, and it's really about the individual small business person's stories. It's those individual stories that I see and I hear all the time, and those are the folks who really are the ones that this is all about. This is all about coverage for people that never really have coverage. We hear about the politics, we hear about the pricing, we hear about the policy, but in the end, it's really about the people. And it's about the people, in many cases, who don't have coverage, that are their stories, their individual stories are the ones that this is about. A woman that I heard a story about this week was just exactly along this line. She's an independent business. She runs her own little small business, home health care business. She got her coverage from her husband, but her husband is in the tech world and has moved around from job to job. Sometimes it had health care, sometimes it didn't. At this point, she didn't have health care coverage. She was running her own independent business, didn't have health care coverage, and she noticed that she had a mole on her leg, and she said, I'll wait until my husband's coverage kicks in. A couple of months later, it'll kick in, I'll get checked, they'll see, it'll be fine, I'll be able to get covered by health care coverage. So she waited. There's a 90-day waiting period until coverage kicked in for her. She went and got it checked, and as you would not want to hear but expect, she had melanoma, and it was something that was diagnosed. I think that they understood that they think that they got it early enough, but they're not sure. But it certainly would have been early enough if she didn't have to wait. And the reason I know that story well is because that small business person was my sister. And so for me, I knew from a personal point of view what it is for small business people to be in the situation of feeling like I want to wait because I'm not sure if I get checked now, does that affect my coverage? Does it affect a pre-existing condition? Does it affect my ability to get insurance for my business, for me and my business? And it's the kind of thing that you don't want anybody to be making those decisions. You don't want to be in a position of seeing people put their health at risk because there are questions about their health care coverage. Small business people all the time are making decisions about how they run their business. We see small business folks all the time making decisions about how their business works and how their health coverage actually affects their small business and their employees. And it's to us, what we see is those are the decisions and those are the kinds of things that people look at and say, you know, this is not the way this should work for small business. Small business folks work very hard. I see small business people every day and you work very hard. You do not have to have a situation where you're having to choose between your business and your health care. What this will do for all of us is put everyone in a spot where it's not a choice. Your health care is something that's going to be affordable, available, something you will not lose, something that if you are not able to get health care coverage before, you will be able to get it now. If you have a pre-existing condition, you will not be denied. These are things that small business people and their employees all think about all the time. And this is an issue that I see and I hear from small business people all the time about. So to me, it's not about the big numbers and the big stories of dollars saved and policy. It's about the people who have to make decisions about taking care of themselves, their families, and their employees. And that's who we see all the time. Because small business people, all of you, are the fabric of the community that you're in here. And you are the ones that are carrying all the employment that's happening comes from small business. All of the services that happen in this community are coming from you. You should not have to make decisions about whether health care coverage is available to you. This will make sure that you have that option. And the other part of this, that's the one last thing to think, is that all of us, I think, again, we're all here in the sense that we don't realize that things that are available to us here in California may not be across the country. And one of the things that we have is a very accelerated process for Covered California to make available the information about how the exchanges will work. So what will be coming up very shortly, the exchange information, Herb mentioned a little bit, the exchange information about individuals is out, and it's something that's been out there, and you can go on Covered California's site and see the information about getting information about what it will cost as individuals. Shortly, that same thing for the shop, which was the exchange for small business, that information will be coming out in this next month, all of which is much sooner than any of the other states around the country. So again, we in California are privileged to get service that other places around the country are not aware of. There are many parts of the country that do not know the kind of information that we in California have available to us. So I think that we should realize that we're in many ways more fortunate than others. There's still a lot of questions that people have. There's a lot of complexity to it. But all of us, we're trying to make sure that we get the word out to you about how this is going to work is really an important piece. One last thing I wanted to segue though, because Small Business Administration, HHS is all about health, and Herb is so outstanding in giving the word out about how the Affordable Care Act works. SBA, we do a lot of other things that are really not about health care coverage. So I think that one of the things that you as small business folks should know is that a lot of what we do for you as small business folks here in Sonoma County and throughout Northern California are things that you should be aware of and take advantage of. I mentioned that Redwood Credit Union is a very large SBA lender, one of several SBA lenders in Sonoma County and in Santa Rosa that are really active in making sure that you as a small business person that need to have capital for your business should be aware of, because this is the best way for you to be able to start and grow your business. Getting the financing, the capital that you need comes from the SBA guarantee program that we do. The other thing that we do is we spend a lot of time trying to make sure that small businesses get good information about starting, managing, and growing their business. So Mary Cervantes from the Small Business Development Center here is the SBA program that does small business counseling in Sonoma County. So if you're looking for information about how to manage your business better, how to get better marketing advice, how to do the kind of financing understanding that you need to have, take advantage of the Small Business Development Center program, because we have counselors that will do one-on-one business counseling with you. So in addition to thinking about the Affordable Care Act, keep in mind that managing your business day to day, the capital that you need and the advice you need is a big part of what SBA does too. So with that, let me stop, because I know we're going to have an opportunity for questions, but I'll end it with just this. Every day I have a privilege to work as a public servant for you, as small business folks. It's a privilege of my career to be able to do that. Thank you.
Mark, thank you very much. I mentioned the Kaiser Family Foundation, and I didn't want Herb to be the only one to show a cartoon. So if you get a chance, if you go to kff.org, they have it's brand spanking new, and you have to look at it. It's a really good synopsis of how the Affordable Care Act works.
Thank you, Congressman Thompson. So I'm gonna really try and run through these questions as quick as possible so we can get as many, but again, we will answer them in email if we can. There were just a couple of brief info questions. There will be enrollment online starting October 1st. If there's one flyer you should go home with today, it's this blue one right here. It's got the website and the phone number for the county. And yes, the marketplace enrollment will be available software online October 1st, and you can also get a navigator on the phone through the phone number. So please make sure you take this home with you. And then one other informational issue is about that I can answer is how is Sonoma County going to offer mental health parity? The feds are all still working on the regs, but what I can tell you is that the health plans are going to be required to provide both enhanced and integrated services relating to mental health. That was actually a federal law through the CMS Department, Centers for Medicaid and Medicare, back in 2008. So we will be able to enforce that, and there will be expanded mental health services and mental health parity along with substance abuse. Okay, first question here is, are there going to be other town hall meetings on the ACA for the general public? And I give Mike an opportunity to tell you when those are going to be.
Thank you. Yeah, I'm going to hold a number of those throughout our 5th Congressional District, starting in September, October. We're still working on the dates, but the answer is yes, be open to the public. It's important, as everyone knows, to get the word out.
And then there were also for Mike, there were some things that were exempt. They've heard that Congress is exempted in some ways from the provisions of the Affordable Health Care Act. First of all, is that true? And if it was true, what were the things that Congress wanted to avoid?
Not true. Members of Congress are specifically required to buy their health insurance through the exchange. And matter of fact, and there may be some change to that, and I don't know for sure, but the way it was written was a Grassley amendment, and it was written in response to those who were saying, well, if this is so great, why doesn't Congress get it? And it was written in a way that it wasn't very good. And there may be some changes to that, but I will guarantee you that when all is said and done, members of Congress will buy their insurance from the exchange. And it was written in a way where leadership members of Congress and leadership staff were not included. So if it stays the way it is, if you're in the leadership or if you're the staff member of the leadership, you stay under the current system. If you're anybody else, you go to the exchange and buy it on your own. And I don't think it was anybody's plan that you would have to go out and buy it on your own unless that's what you want to do. So if you're a business or you work for a business and you have an employer that provides health care, you shouldn't be forced to go buy it off the exchange if your employer is doing. I think that may be the change that happens in Congress. So it's still a group plan, but it has to be purchased off the exchange.
And I should have mentioned earlier, and we'll talk about, I'm sure, in the Q&A, but the individual requirement for health insurance, there are some exemptions to that. There is a hardship exemption. There is an affordability exemption. Even on the employer side, there's an unaffordability exemption about employer coverage. So just so you know, if you're not filing taxes, you're not subject to the individual requirement or other hardships or some other things as well.
And one last thing, kind of on the subject, whenever anything like this comes up, death panels, members of Congress don't have have to be part of Social Security, they don't have to pay back their student loans, any of that stuff. You know, you can go online to Snopes, is it .com, I think? And they'll answer that for you. I get so many questions that come into the office that, you know, we heard that, and usually it doesn't pass the giggle test. But if you go on Snopes, it'll lay out what the claim is and whether or not it's true or false.
Thank you, Congressman. Okay, I've got a couple regarding small employers that I think Mark or Herb can answer. Small business tax credits are only available for 2 years, not anymore? Or not more than 2 years? Yeah.
No, they actually were what started beginning in the tax year 2010. So literally it was upon enactment. So if you are one of those small businesses that are under 25 full-time equivalents, you were providing coverage, then you should take a look and we can connect you with the IRS, because if you were eligible for the tax years 10, 11, 12, or 11, 12, 13, and weren't taking them, the IRS will let you go back and claim them. 25 cents for the tax exempts off a dollar premium, 35 cents for the for-profit. In 2014 and 2015, those numbers become 35 cents off for the tax exempts and 50 cents off. So it actually, those provisions were for 5 years, including the past 3.
Thank you. And then are there any reporting requirements for employers with under 25 employees?
When you talk about, I'm not sure whether the question is geared towards the IRS side of the reporting or the DOL side of it. I will say from the DOL side, employers have a responsibility to inform their employees or prospective employees as well about the marketplaces in their area, because there is a provision around unaffordability or if the employer happens not to be providing coverage. But I'd be happy to have somebody talk with me after or send me a note, and we'll talk about which other reporting requirements that you're doing. But the employer requirements, it's not actually fully done through the tax system whether or not you actually owe penalties. It's actually done the traditional IRS way. They identify whether or not, from you saying how much we're spending, when you're 50 or greater, you have to put on how much you're spending and what your health care coverage is. They may come to you and say, well, we know there's tax credits that have been given to some of your employees that didn't take your coverage, so you may have a penalty associated with that.
And then maybe, Mark, you can help us with this one. Will the small employer be able to use a health reimbursement arrangement, commonly known as HRAs, so that their employees can participate in Covered California? Or her, yeah, okay.
Answer is yes, with limits. There are some changes, and we have recently, in our affiliation with the IRS, have an IRS expert on hand and can sort of go through the technical detail. But yeah, there are just some limits that were put on the amounts that were in there. But you still have HRAs and HSAs and things like that.
And since we're still talking about taxes and health insurance invoices, this question is there a tax or fee being added to the health insurance invoices of businesses that provide health insurance to their employees? And how is that tax calculated? Okay.
There are provisions. There is a tax on medical devices. There is a fee on health insurers and some others as a part of, if you will, the sort of revenue side of the equation. But as the Congressman said, you have to look at it at its sort of overall. It's going to lessen the deficit $100 billion in the first 10 years and $1 trillion. It's just the way that it all works for. It's fully paid for. And it just really depends on sort of where you sit. But there are some industries, including the health plans, that do have a part of a fee put on them in order to help, again, broaden that coverage.
And then maybe the Congressman can help with the next question. Part of this is that how those taxes or fees that are going to be collected Are they going to be used in particular for health coverage, or how are they going to be used?
Well, as Herb said, there are a number of means by which to pay for the ACA, and that's what they're used for. That's how the Congressional Budget Office was able to determine the deficit reduction and the savings, and the fact that it is paid for. So, yeah, it all is credited to that.
Great. This is a good general question. How will unemployed people access coverage and pricing comparison?
Well, that's a great question, and it allows me to give you, I think, a really sort of newer development that's great. And I think it's very clear that this is not just a Small Business Administration, Department of Health and Human Services, IRS, Department of Labor. This is an administration-wide effort. And so each of the regional directors, in coordination with our regional administrator for the Centers for Medicare and Medicaid Services, a big part of HHS. Each of us, there are 10 regional federal work groups across the country. And our responsibility, Mark as a chief member, is to work across the entire government. So we're working with not only SBA, we're working with Department of Labor in many of its different divisions. We're working with the USDA and the Food and Nutrition Services that provide WIC services and that provide SNAP, the old food stamps program. We're working with our administration and Children's and Families. So on the unemployment side, we're working with the Department of Labor and state departments of labor that provide services, so that no matter where you're going, if you will, with the program I talked about, the Navigator program, the community-based programs, the goal is to make sure that where you live, where you work, where you play, where you seek services, Social Security Administration offices, that you will have information that's available, VA centers. You will have information that's available, and there will be federal staff that is trained to be able to at least demonstrate to you, here's the websites, here's the computer, or here's the Navigator in your area, or actually these folks over here can assist you in evaluating your coverage. So in California, there are now 48 organizations that have been hired across the state in different areas, including here, to do that outreach and education, to tell you, here's Covered California, here's the type of plans that are out there. If you already have individual coverage or small business, here's how you can compare the new ones. And then there will be assisters that those organizations and others that get hired, because many organizations have benefit counselors, community health centers do. They are being actually paid to be able to enroll and assist people in. So the unemployment insurance side is a very, very key part, because likely you may have issues with folks who are also then accessing, maybe it's SNAP, maybe it's an employment and training program through a workforce investment board, maybe they're in the VA system as well, and so they will have the opportunity. And so we're spending a lot of time educating and training our federal colleagues throughout the region to be able to help in all those settings.
And again, I just want to say, use the phone number that was given to you on the flyer, because we will have live navigators through our Health and Human Services Division, and they have to answer those questions within, about 6 minutes? What's the state requirement, Jerry? I've got our Director of Human Services sitting here.
The state has given us 30 minutes to do an application, but 30 seconds to answer an incoming phone call.
Oh, you got that, everybody? Talk about customer service. 30 seconds to answer the phone call and 30 minutes to do an application. That's how fast you're supposed to get enrolled by the state.
And I will tell you, we've provided about $8.5 million through the ACA to the state to be able to beef up their consumer assistance divisions within the Department of Managed Health Care and the Department of Insurance. So if there are problems or issues with coverage, there's a greater ability to respond to those.
And I do want to say also that in terms of that, the whole issue of enrollment too, that you can enroll yourself online right on October 1st in terms of the California coverage. So by all means, go to the website, check it out. There's lots and lots of information. And somebody asked about mailings. The state is going to be doing a mailing with the county or to the county residents regarding the California coverage program. So stay tuned. You will be getting mailings in the fall. We want to get the information out as much as possible.
If you sign up on our listserv,
And
you'll
you can
see it.
There you go. Sign
How
up.
ongoing.
There you go. This is a really important question because a lot of people I know have been asking me this and asking the National Committee to Preserve Social Security and Medicare, which is how the Affordable Health Care Act is going to affect the cost and coverage to Medicare for seniors. As I mentioned earlier, Medicare continues to be the most popular and health insurance program in terms of customer satisfaction. So.
Well, for starters, it's already extended the life of Medicare, so we're already seeing a benefit accrue to folks from that.
That's great.
Yeah, and it's
Wonderful, yeah.
right. So what the solvency for an additional 12 years, I believe, as well as 8 to 12 years, as well as the addition of the two benefits we talked about before, now under Medicare. So the benefits did not change. Two were added. And so one was the free out-of-pocket cost of preventive health. So, cancer screenings, actually nutritional screenings and counseling as a part of that for seniors, the annual wellness visit, which is free of charge, and their ability to go and talk with their providers about their health. That's one. And then that donut hole, that provision in the law that at a certain point required seniors and people with disabilities to pay 100% of their prescription drug costs when they're most vulnerable, is being eliminated over a 10-year period. And so the California numbers, as we said, was several $100 million saved. It's been billions of dollars saved, I think over $7 billion now saved nationally to be able to, if you will, help seniors and people with disabilities pay their prescription drugs. So when you hear, to the Congressman's point, benefits being cut in Medicare, it's quite the contrary. The old Medicare program, the benefits were not cut, and then there were the additions of these two programs, preventive health and health pay for prescription drugs. I heard of one occurrence, this is absolutely, as I was in another state, where they had an elderly individual coming in, and he had, and this is not in California, 740 visits to the emergency room. And so fortunately, the folks in the hospital said, something's going wrong here. Something's going on. There's one thing called frequent flyers in the emergency room, as we call them, but something's wrong, and we need to help this man. Well, what happened was he would come in, congestive heart failure, and they would give him, they would stabilize him, and they would give him a week or 2 weeks supply of medicine. Well, then he would go home, he couldn't afford to pay for the medicine. So he'd have to choose between, do I get the medicine or do I eat? And so no senior, as Mark said, should ever have to make a decision between eating and their medication. And that's what the elimination of the donut hole is all about.
So this one is, will individuals be able to keep their current physician?
Yeah, I mean, the president said, and this was a very big point that we think the people of the country asked for, and that is if you like the health insurance that you have, you can keep the health insurance that you are. If a provider retires, that's one thing, but the health plans have put together networks, and those providers in those networks will provide coverage. I mean, you can't say, well, this doctor's going to move and do that. But if you like the health care coverage you have, you can keep it. It's also, as we said, 85 to 85% already have coverage. They have coverage predominantly through their employers. All of those sorts of things to do that. So.
Okay, and then one of the very last question has to do with expanding coverage to spouses and to dependents and children. So I think the question is really, is the marketplace going to be available for individuals whose spouses already have employer-provided health care?
That answer is yes. That answer is yes. When it comes to sort of the coverage through the employer, Dependents will have to be able to be covered, but there's not a requirement on the employer that they pay for that coverage. It's the employee only, but a spouse can, work in one place and get his or her coverage from there and get it on the other. The responsibility is just to make sure they all have credible coverage. So you could have Medicare, you could have Medicaid, you could have employer-based, you could have VA, you could have TRICARE. There are a lot of things that already today, if you're in a retiree-only plan, or you're in, a lot of people ask this question, COBRA, they all qualify as what we call credible coverage. In other words, credible coverage means you've met the requirement as an individual that you have health insurance as of January 1. The other thing I should mention in closing, because I think this is a big one, is a lot of folks have asked us about the employer responsibility. And that's the issue of the 50 full-time equivalents and greater that are considered large employers. And we talked about 96 to 98% of them are already providing coverage. And what we're doing about that. We had the employer community, both small and large, have been working through with us and with Department of Labor. There's a lot of reporting requirements, and we're doing our best to streamline those reporting requirements to help employers. And so we're talking about 96 to 98% of those employers that already provide coverage. So what we've said is, in 2014, you're not going to face the penalty provisions. Most of those, 96 to 8%, will continue to provide health care coverage. They just won't be subject to the penalty in 2015. So it's giving another year to make sure that we can better streamline all of these reporting requirements for employers to allow people to focus on their businesses and their employee health. And so I think there's been a lot of misinformation about that. But the people that are subject, the employers that are subject to that provision, 96 to 98% are already providing the coverage and will continue to do that regardless of whether the penalty provisions are in effect or not.
So I just want to say, as your county supervisor, that I'm going to pass this over to Congressman Thompson for conclusionary remarks. But I want to just say, I'm looking forward, quite frankly, to 40,000 people having health care access in the next 6 months that don't currently have it, and a huge investment of health care dollars into our county and becoming the healthiest county here in the state of California. And I really want to thank our wonderful panel, and especially the congressman, for hosting this town hall public forum.
Shirley, thank you, and thank you to the other panel members, Herb and Mark. You guys have been great as always. Thank you all for coming here. Herb said something that struck the memory bone in my head that I think encapsulates all that we've been talking about, all that we want to accomplish. When we talked about the guy who had 700 visits to the emergency room. When we were doing the Obamacare legislation, I got a call in my Eureka office, that was in the district then, and a guy told my aide up there, he said, we don't need to do healthcare reform. Healthcare system is fine, doesn't need to be fixed. And she said, okay, I'll pass that on. He said, no, I want to tell you why. He said, I was in an accident. He said, I spent 3 months in a hospital, almost a year in physical therapy. He said, I'm better now. He says, everything's fine. He said, the system worked fine. And she said, well, how did you pay for that? And he said, well, I didn't pay for it. He said, I don't have any money. He said, she said, well, who was your insurer? He said, no, he said, I don't have any insurance either. I'm just telling you, it worked out fine. And I didn't have to pay a penny. And I think that's important to remember because I don't know what our districts are different now, but in that old district, when I represented the 1st Congressional District from the Oregon border down the coast through Sonoma County and Lake and into Napa and Yolo County, that year, the year that we did the Affordable Care Act, the uncompensated care cost in our district alone was $50 million. That's what I was talking about when I said this was a national crisis. And we've got to figure out how we better deliver health care, how we make sure we treat people's health concerns and get rid of all of the duplicative things that we do, make sure that we deliver health care in an environment that doesn't take place in the emergency room, unless it's truly an emergency, that we're able to do this in a way that keeps this, the cost of healthcare down, because we can't go on the way we were. So these meetings are important. Thank you for coming out. And as I said, we'll be holding more for town halls for the general public, because it's important that we get it right and we get people enrolled. So thank you all very, very much.